Proper sanitization and access to clean potable drinking water has apparently become a luxury. Not for the elite, but I mean specifically for the needy. In countries like Nigeria, where open defecation and lack of potable running water remains rampant, cholera has actually become endemic. Governments at all levels have largely abdicated their responsibility to provide potable water, prompting individuals who can afford them to drill wells and boreholes indiscriminately. On Viewpoint, where we discover perspectives and embrace dialogue, we've got a medical doctor, clinical researcher, and healthcare consultant, Dr. Oghenekome Agha. She'll be taking us on the cholera outbreak. Join us in the next phase of the show. And before you do that, you do well to subscribe to our YouTube channel and follow us across various social media platforms. Join us in the next phase of the show. Welcome back to the show. The show is Viewpoint, where we discover perspectives and embrace dialogue. Go with me on the show, Dr. Kome Agha, and she will actually be shedding light on the cholera outbreak, which has actually become endemic in a scourging manner, actually. Doctor, you're welcome to the show.
Good afternoon. Thank you for the opportunity to be interviewed on the show.
Okay, you're welcome on board. Actually, why we have you here is actually to shed light based on the roles the health agencies and also likewise the government paramountly should actually be performing as a medical practitioner. That is why we have you here today on the show. Now, there has been similar outbreak back then in 1991, 2017, and now as we speak in 2024. These years have just been mentioned by me now on the show, has recorded thousands of cholera cases. Suffice it to say that cholera as a communicable disease always lies in wait, ready to pounce once there is a situation in a country like Nigeria where it has actually become endemic. Will you agree that governments at all levels have largely abdicated responsibilities to address germane health issues, such as providing potable water for drinking for its masses?
Okay, I feel regarding the cholera outbreak, the government has responded through the organization of the outbreak response team and surveillance unit of the Department of the Public Health at the NCDC level and the state's Ministry of Health level. Okay. However, the government has its role to play. Though the government has its role to play, the people and the citizens of Nigeria also have, their own responsibility to play in maintaining the public infrastructure and maintaining good food, water, and hygiene. I'm sure as of 2 days ago, the Lagos State government, they brought out, there was an interview by the special advisor to the Lagos State Minister of Health that, they discovered that people that contracted cholera had ingested unregistered tiger nut drink, and this was discovered upon contact tracing, that is taking of history to find out what they have ingested and all of that.
Okay.
Upon further investigations, they also discovered that these tiger nut drinks, these drinks were not registered with the NAFDAC, that is the National Food and Drug Administration, that they ensure the safety of consumables. Okay. So this also emphasizes the role we as citizens of Nigeria, particularly food vendors, in maintaining their hygiene. We see that food vendors are using pesticides for food preservation. They wash their foods with wastewater and poor defecation, poor hand hygiene, and all of that. So all of this is an individual is what we as a people, we as a country have to take note of. We have a role to play.
In furtherance to what you just said, breaking it down, it therefore means that cholera doesn't begin and end with water-based products. Even though water, yes, is definitely germane to being used to cooking and all sorts of items we need to use. You made mention of the tiger nut drink. Now, actually, these products now, which are ingested, lack registration numbers from the food agency NAFDAC. Now, what actually should are there penalties in place actually to put these people in check?
So now this is what the Lagos State Ministry of Health, they are now, they're on top of their game, making sure that they are, infiltrating these places. So from the interview, we saw that on the Tiger Nut bottles, they just, saw the name and the contact person of the person that made the drink. So by that, they are able to infiltrate and find other, sources of, all these unregistered drinks, Tiger Nut, Zobos, and whatnot.
Okay. Okay, that's informative enough. Now, this recent cholera outbreak, now it actually erupted a fortnight ago in several states of the Federation. The Nigeria Center for Disease Control actually reported 1,141 cholera cases nationwide, with Bayelsa and Lagos states recording 400 and also 324 cholera cases respectively. Now, these are how have spontaneous reactions coming from the government now and health agencies alike reacted to curb these excesses of cholera? Because frankly speaking, if we look at it, it doesn't begin and end with just the Tiger Nut case. Are there instruments in place to make sure that not just, because whether we like it or not, there's also corruption, because there are news making the rounds that actually NAFDAC numbers or NAFDAC registration numbers are actually even bought, even before the product is churned out there for consumption. So this is another careless act on the part of the government agency, such as NAFDAC, that might actually be propagating this endemic disease, cholera. Are there instruments in place to put them in check, actually?
Like I said earlier, that about the Lagos State government being on top of the game, and the interview from the Lagos State government that, discovered this. We're also saying that other state governments are also on their game. For example, like your state government, they are launching out prevention, strategies, informing what we call the public health education for their, for their community members, for their residents in your state, in whatever state you find yourself. So I find that, state governments, local governments are on top of their game, informing, the residents and the citizens of the state about, cholera as a whole, the causes of cholera, the symptoms one would see cholera, and then the prevention strategies, that is, safe water, boiling of water before you drink, proper sanitation, disposing your waste, make sure you wash your hands after waste disposal, regular hand washing practices with soap, before eating, after using the toilet, and then food safety, how you cook your food, and all of that. And then treatment strategies. Once you notice that the first moment you notice, particularly in this, in this cholera outbreak, you notice that you're vomiting or you're stooling, I think it's best to present at a healthcare facility, a primary healthcare facility, and then they take it up from there, give you ORS, rehydrate you with ORS and all of that, and give antibiotics if needed. I also believe that there are NGOs that, are also on top of their game. For example, I saw some, an association of health educators over the weekend. They went into the Oshodi community educating, the market women, the market leaders on cholera as a whole. Even aside from cholera, that, safe water, hygiene practices, hand washing will prevent against certain, illnesses, will prevent us from contracting certain illnesses. So this, NGOs, these agencies are on top of their game, educating the populace. Okay. So I believe that, and there's a role they play, and the brunt of this is also left on we as individuals, we as citizens. We need to be particular. We need to be strict with our hygiene standards, and then food vendors, and all of that. So we as an individual also, yes.
Okay. You made mention of the federal government and the state government, and probably also the local government being on their toes concerning the situation. Now, it doesn't just end with the government alone. The individuals who are the masses in which the government is actually catering for, they put up some kind of like a desiccal attitude. Now, the programs or campaigns in which the states, the federal, the local government is actually putting on, will it actually even get to remote areas? I say this why? Because in remote areas, such as rural areas now, to be specific, we have most of the needy or destitute people in place. We call them poverty-stricken. Now, according to former president of the Nigerian Medical Association, the NMA, Innocent Uja, cholera is a disease associated with poverty. Now, on my own part, I tend to, and also not tend to, agree with this notion, because if we map out the country, we'll find out that the places where there are outbreaks in cholera are underdeveloped regions where people fetch water from dirty places to drink also. And even those places also, while people are even defecating and as filthy as they are, they also use them washing their clothes. Also because this open defecation during rainy seasons, all these internally generated human waste will then wash down into these streams, like I said earlier on, and people will still drink and fetch home for people to take in. Now, also including that, considering the boisterous nature, particularly in children and adults inclusive, to what extent now will measures now be applied based on awareness campaigns? I'm saying this because of where you've come from, based on the federal, local, and state governments being on their toes to checkmate unforeseen mishaps. Because if we check down the records, it happened in 1991, happened in 2017, and it's reoccurring again now in 2024.
Yeah. So yes, I agree to what all that you said, and a colleague of mine, I reached out to my colleague who works at the Ekiti State, and was informing me of how they had they went into the communities, into out to reach areas, informing people about cholera. And then I said earlier that hygiene practices, that is water, sanitation, and hygiene, is not just we're not just giving this education just for cholera alone. It also helps prevent against other, diseases that we could ingest as a result of, poor hygiene practices. So I believe that even aside from the government, there are health agencies, there are NGOs that are going into the underserved communities, informing them about, the need for water, sanitation, and hygiene. We're informing people that, now you need to boil your water very well before drinking. Informing people that people that don't have access to good water supply, boil your water before drinking. So I believe that everything is in place currently, and I think that the government is on top of their game. But also, I said this earlier, that despite the role the government and health agencies have to play in this, it also a large percentage of this also falls on the individual, whether you take whatever you're saying. I know of an NGO that they've taken it upon themselves to go into primary schools in Lagos State to educate children. So they're teaching the teachers how to they're teaching the teachers water, sanitation, and hygiene practices. So these teachers can in turn teach the children how to wash their hands, when to wash their hands, and how to wash their hands. And with all these strategies in place, I also believe that we would have a reduction in such occurrences in the future.
Okay, that's quite elaborate enough. Now, globally speaking, a World Bank report on water supply, sanitization, and hygiene, the sector, which is actually addressed as WASH on its acronym, it actually paints a scary picture on the access to clean water in Nigeria and how this will impact adversely on the livelihoods of numerous Nigerians in both rural and also the urban areas. Also, likewise, the WHO, the World Health Organization, and United Nations Children's Fund, UNICEF, they recently observed many often resort to using available spaces for convenience for those who can afford it. Now, I'm talking about the boreholes here, which are indiscriminately dug. Shouldn't this actually be taken into cognizance for short-term and long-term solutions?
Okay, so while people use boreholes as alternative sources of water, and then there are like an indiscriminate digging of boreholes, I think this is where what we call the environmental health officers, where this is the role they have to play. So I believe that the environmental health officers should be brought back to ensure this strict adherence and to enforce, environmental laws, sanitation laws, particularly at the local government level and then the state level. So if we can bring in the environmental health workers in place, they are the ones that are going to the communities, into the local government, starting from the state level, local government level, they go into the communities and ensure the strict laws, and I believe that the indiscriminate digging of these boreholes will reduce once we have these environmental health officers, because this we see that from practice that indiscriminate digging of boreholes, most people don't adhere to the standard, and then it predisposes them to contamination with pathogens, and this is where cholera can come in. So the environmental health officers, yes, would play a great role in this adherence.
Okay, okay. So in summary, in sum total, everything you've actually said and taken time to elaborate on still surmounts or bases on the sensitization and awareness campaign ultimately from not just the government but also cascading down to also the individuals alike.
Yes,
Okay.
yes.
Well, actually, Doctor, it's been nice having you on the show, and we wish to have you from time to time when it has to bother on issues concerning the government and health issues and the Nigerian people. Thank you for joining us.
Thank you very much. It's a pleasure.
Well, that was Dr. Oghenekome Agha, who actually is a medical doctor and also a healthcare consultant. And she took time to elaborate concerning the involvement of each stakeholder from the federal, state, local government levels in the healthcare sector. As seen in any case, in any other health issue, prevention, they say, is better than cure in tackling any other ailment, particularly now cholera here in question. We implore the private and public sectors to engage in adequate sensitization and awareness campaigns on any issue. The show has been Viewpoint, where we discover perspectives and embrace dialogue. I've been your host, Odiawa AI. You do well to subscribe to our YouTube channel and follow us across various social media platforms. Thanks for watching.